Hello everyone, hope you are all doing good. A mother recently approached me regarding constipation problem in her child. So I thought I'll take up this topic today. Constipation, what would you consider constipation? When your child has less than maybe three bowel movements within a week can be considered constipation. What happens, there are some stages at which you'll see the constipation being more, like in an infant stage when the child is shifting from liquid to solids, in a toddler age when the child is being potty trained, in a older kid when they are starting the school. These are some of the phases, and apart from this also you might see constipation otherwise. Now, what can be the reasons behind constipation? It can be the child is withholding and not telling, child is avoiding the urge. It may be because they are busy playing, or they are not wanting to go into during the toilet training to sit on the potty. And what happens at that time, the stool is stuck in the colon for longer period of time and the water gets absorbed and it becomes harder. So the child is not able to pass. It also can be less sleeping. It can be because of the less hydration. It can be because of the less intake of the fiber in the child. It can also be because of the less motility of the intestines. It can be low tone, because of which the muscle strength is less in the core area or in the pelvic area. These can be some of the reasons which can lead to constipation. There can be change in the routine of the child, which also can lead to the constipation problem, and also certain medications can lead. Some of the antacids, for example, the seizure medications, some pain relieving medications can also lead to constipation. So if these are the reasons, then of course, if the medication is the reason, then we can reach out to the pediatrician or the neurophysician whom you are consulting to change the medications accordingly or help you out. But otherwise, from a therapist perspective, what I can tell you is there are few massages which you can do to help your child. There is a routine you can set for your child. There is a sleeping pattern or easy to sleep or relaxation you can give it to your child. And also the nutrition, from a nutritionist point of view, the diet can be a big factor, for which I will call a nutritionist soon on the page to help you. So the massages which you can do. There are some massage techniques, like for example, you can make the child lie down, you can keep a pillow under the head and let them relax, and then talking to the child at that time, you can talk, give the massage, how you're feeling, is it good, are you feeling good? And then you can go in clockwise direction on the tummy, starting from the bottom and then going up clockwise. This is a circle. Give the massage, how you're feeling, is it good, are you feeling good? And then you can go in clockwise direction on the tummy, starting from the bottom and then going up clockwise. This is a circle. This is a circle. You show me how you make circle with your hand. Like that, it will be an interaction and it will reduce the anxiety in the child. Anxiety is being another factor for leading to constipation. This can help. Then there is a massage technique called I love you massage. So what is I love you massage? What you do is you start from the left side of the stomach, going from up to down, like this I, and then you start from the right side of the abdomen up and make a L towards the left side and then down, love, and then from the right side bottom to going up and then in a circle towards left side, you. And at that time you can talk to your child also to relieve the anxiety. I love you. I love you. And that will help the mobility of the stool in the intestine. The pressure of the massage should not be really deep, and it should not for sure be superficial. It should be a firm pressure going slowly. In a small child you can use 2 fingers, in an older child you can use 3 fingers also, but 2 fingers are enough. If the child is quite old, then you can even use the pad of your hand, like in adults this also helps. And in the smaller child's, fingers are good enough. But if you feel they are poking, try not to use the tips of your finger, try to use the pad of your finger, and without poking, going in a very gentle way and asking in between. If they are having the pain, then change your technique, go circle or go slowly, starting from just this and then going towards the I love you massage. So these are the massage techniques. Regarding the nutrition, that is high diet fiber intake, which can be grains, fruits, vegetables. Of course, it changes according to the age of the child, which I'll help you soon with the nutritionist. And the water intake, which again changes according to the age of the child. Then you can have warm and soothing baths, which will help relax these areas, the pelvic floor muscles. Then you can teach them or guide them with the breathing exercise. For example, tell them breathe in through nose, blow up your tummy, and then breathe out through mouth like a fish. So if they are sitting on a potty seat and they are not able to pass the stool, at sitting at the potty seat they can do this exercise, and which will help them relax their muscles and pass the stool. Also, make it a routine for them to sit on the potty seat after the meal for 10 minutes, especially if they are having constipation. This puts into the routine and it's easier for the child to pass the motion after the meal. Make the routines, you can use again the reward techniques, the consequences for them to follow. So many times it happens that they are withholding the stool just because they want to keep on playing. So fixing a routine or making a routine for the potty time will help this. Fixing even the meal time, the sleep time, even so many techniques for sleeping can be used to put into a routine for them to fix sleep at a fixed time. For example, the music, the aroma, dim light, relaxation music, even meditation. These things can be used. Children in their second year of life play a lot in the squatting position. That also helps develop the pelvic area muscles and also relax. So see if your child is not playing a lot in the squatting position. That might be because of the low tone or because of some other reason, but playing in squatting will help them a lot again in battling with the constipation. So squatting, from squatting getting up, that's the milestone they achieve before going into half kneeling and standing up. So squatting will also help, and some other exercises as I mentioned earlier for the low tone, which you can work like for the core, which can be animal walks, wheelbarrow walking, and these kind of things will strengthen these muscles, and that will help in the battling with the constipation problem. Although I'm not a nutritionist, I'm not a pediatrician, but I am telling from my experience, from a therapist perspective, which we have seen the kids facing constipation, how we have helped parents to deal with it. And these are certain things from my side, and I will soon call upon a nutritionist on my page to help you guide with the diet and the hydration part, so that will also help you in dealing with constipation in kids. And if you have any other queries, please reach out to me, please DM me, I'll get back to you. Thank you.